Welcome back to the Let's Fix It series about the American healthcare system. I'm Dr. Chris Robertosi, a practicing podiatrist in Newton, New Jersey. This podcast will review various healthcare systems. They all have the potential to get us to our desired goal. Regardless of what finally comes out of the discussions, there will be compromises and some creative twists to make the new system function better. Your input is important. Please go to the website www.betterhealthcarereform.com. In the upper right-hand corner of the screen, click on Contact Us and share your ideas with me so that I can bring them to the meetings. As mentioned in the first podcast, the United States is the only high-income country that does not guarantee health care for its citizens, nor does it have universal health care. So let's start with the pros and cons of universal health care. That is where every citizen is covered for basic healthcare needs run by the government. The pros for universal healthcare system are that catastrophic, emergent, and urgent illnesses are covered. These tend to be the most expensive for the patient in the fee-for-service model, leading to large medical bills. Other medical care is covered too, but not every service that is provided by physicians is part of universal healthcare coverage. Second, you are covered regardless of your health history. Third, no one is left out without basic health care. The cons for universal health care are more extensive. The biggest misconception is that universal health care is free. Nothing could be further from the truth. It is paid for through a healthcare surcharge that is taken out of your paycheck. It is usually a percentage of your gross wages in the range of 20 to 30%. The rates are set on a national basis. Those who do not work are not paying into the system. Those individuals are supported by the government and those who contribute through their payroll health care surcharge. Second, while treatments for catastrophic, emergent, and urgent illnesses are covered, that does not mean that you will be getting cutting-edge care for that disease. Third, elective procedures such as knee or hip replacements have long waiting times to be performed. Authorizations are usually required for elective procedures before they can be scheduled. Fourth, universal health care does not cover every physician service. Fifth, the services in healthcare that are provided at any given time are based on the amount of money in the budget for that treatment. Sixth, many individuals purchase private insurance, which adds to the overall cost to the individual. Seventh, there is no choice of insurance carriers if it is run by the government. Eighth, there is no competition. Ninth, if you are working, you don't have a choice whether the money is taken out of your paycheck. The term single-payer system is often used synonymously for universal health care. However, a single-payer system means there is only one insurance carrier. It does not mean that everyone is covered. It can be run by an insurance company that is contracted to provide the service or the government. The pros are that the system can have whatever options are decided on by those designing the system. Second, the payment method is open-ended. Thus, it can be paid by a healthcare surcharge on everyone's paycheck, paid for by the employer, paid for by the individual who doesn't work, or a combination of the ways listed. For instance, both the employer and the employee can contribute to the payment. It can be a set fee or a percentage of the paycheck. The cons for a single-payer system are that there is no choice of insurance carriers. Second, there is no competition. Third, not everyone is covered. Managed care is the present system in the United States and has been for the last few decades. In its present format, it has brought us to our atrocious ranking. Doctors and patients decide on the treatment plan. The insurance company decides what they will cover. The physician submits a bill for the services provided. The insurance company decides what they will pay. The pros are that the managed care keeps the cost of healthcare down by not allowing medically unnecessary treatment. The cons are the administrative burdens to control the care provided are costly and time-consuming, thus taking staff away from caring for patients to do the paperwork. This increases the cost of care by having staff do the extra paperwork. Second, networks limit patient choice on who they can see for their care. Third, the cost has gotten prohibitive in most cases for individuals who pay for their own healthcare insurance. The upcoming trend is value-based reimbursement in the managed care system. This has the potential for bringing costs down. However, in order for it to be fair, both the physician and the patient's contributions to the care must be incorporated in the calculations. For instance, the physician can make the correct diagnosis, order the right tests and medication, but if the patient doesn't take responsibility for their part of the care, such as taking the medication as prescribed or showing up for the appointments, the outcome will not be optimal. This affects the overall quality of care that is provided in our healthcare system and the level of reimbursement. Part of the dilemma goes back to affording the medication or getting a ride to the provider's office. These issues must be addressed to improve the overall health of Americans. Fee-for-service is where the United States started with healthcare. Healthcare has been criticized as not having any competition, and thus the cost continually goes up at unprecedented rates. Every business that provides professional services can charge whatever they desire. With the plumber and the electrician, there is competition because the individual that is requesting their services is paying the bill. Those requesting professional services shop around and see who will do the best job for the best price. On the other hand, healthcare providers are presently paid by a third party that determines what they will pay for the service. So, the system presently has no competition in it the way it functions. One way to bring the price down is to introduce competition back into healthcare. The pros are that the system will introduce competition back into healthcare, both at the level of the provider and the insurance company. If the patient knows what the provider charges and what the insurance company pays for the services, the patient will be selective about what insurance they purchase and what providers they see. It can eliminate a lot of the administrative burdens. The patient can select the care level they want if they know the cost, reimbursement, and out-of-pocket expense. The cons are that not everyone is covered. The cost for emergent and urgent care could get expensive for the patient. I truly believe that a fair system can be designed for the United States that can get us delivering the best healthcare in the world. I have several ideas to make it better that I will divulge at the Zoom meetings. The reasons for not sharing them now is that I don't want to stymie the creativity of others by proposing solutions now, which can bias their thought process. It is likely that someone out there may have better solutions than me. Your solutions are important. Please share them with us through the website www.betterhealthcarereform.com. If you want a better healthcare system and think that what I'm proposing will get our country there, then contact the organizations in the comment section and ask that they send a representative to the Zoom meetings to start on February 5th, 2025 at 4 p.m. Eastern Standard Time. They have all been sent an invitation for the proposed collaboration on healthcare. You can see all the organizations and their phone numbers on the website www.betterhealthcarereform.com. It is appropriate if no one answers the phone to leave a voicemail. A simple statement such as please participate in the Let's Fix It Healthcare Reform Zoom meeting starting February 5th, 2025 at 4 p.m. Eastern Standard Time. Feel free to give your name and any other pertinent information you are comfortable sharing. The listed associations received a letter in December with all the details. Those who attend will write the healthcare propositions that will be sent to Congress to make the appropriate changes, whether it is a law or alterations in the delivery of healthcare. A summary of each meeting will be posted on the website within a few days so you can keep up with the progress and provide feedback. Likewise, the recommended changes that will be sent to Congress for approval will be posted. The Affordable Care Act took 26 months from the time President Obama took office until it was passed by Congress on March 23, 2010. It was not implemented until January 1st, 2014, 45 months later. Our goal is to write the proposal, pass Congress, and be implemented in less than 6 years. Thank you for taking time out of your day to listen to this podcast. Please share this with your family and friends, and let's all work toward a better healthcare system for all American citizens. Please contact the organizations and let them know that you would appreciate their participation at the Let's Fix It meetings so we can achieve a better quality of healthcare for all Americans and reverse our rank in healthcare in the world.